29.1 million people are living with diabetes in the U.S. That's 9.3% of the population. As a recently diagnosed diabetic, I am familiar with diabetes and some of the common treatments. Losing weight, eating a low-carb diet, and exercise can all be used to fight diabetes. Diabetes is a metabolic disease in which the body's pancreas produces little or no insulin and creates high levels of glucose or sugar in the blood. Diabetes can damage the kidneys and may lead to kidney failure. It also damages the nerves that run through your body. It causes foot problems and infections in the feet, and problems with the blood flow to the feet that can cause amputation. Diabetes is dangerous because of all the complications that can occur. For instance, diabetes is the leading cause of kidney failure, eventually requiring dialysis or a transplant. Diabetes increases one risk for heart attacks and strokes by 2 to 4 times. Now that we know a little bit about the disease, let's discuss how you can prevent or manage it. Exercise is very important. It has been said that people should get at least 30 minutes of moderate to heavy intensity exercise 5 days a week in order to help prevent diabetes. Now research suggests that even low intensity exercise can reduce your risk for getting diabetes. Even a leisurely walk, if it's regular, can reduce the risk of type 2 diabetes. According to Harvard Health Reviews, you do not have to run marathons. Walking, even at a relatively low pace, is good, but you do need to exercise for at least 20 minutes a day. There are numerous activities in which you can try. For instance, swimming, weight training, and cycling. If you tend to be a person that is busy, schedule 15 to 20 minutes daily and be active. Eating a low-carb diet. Sugar in the blood comes from foods that we eat. The foods that turn into types of sugar as soon as they reach the stomach are called carbohydrates. This means sugars as in sodas, fruit juice, and candies, and starches are harmful as well. Some starches are bread, pasta, rice, and potatoes. Before changing your diet, a physician should be consulted, especially a low-carb diet. Patients should ask their physicians whether the diet is safe for them and whether they will need to take vitamins or other supplements. Losing weight. Weight loss is a common recommendation for the treatment of type 2 diabetes. Many people are overweight when they first diagnosed, and that extra fat actually increases their insulin resistance when their bodies can't properly use the hormone insulin. Studies show 18 obese people with type 2 diabetes who were given the gastric band surgery and put on a restricted diet for 8 weeks were cured of the condition. During the trial, the patients aged between 25 and 65 lost an average of 13% of their body weight. Crucially, they also lost 6 grams of fat from their pancreas, which allowed it to secrete normal levels of insulin. Some key points to remember. The key to preventing diabetes is to lose weight by eating healthy foods that are lower in fat and calories and being physically active. Set a goal that you can achieve. A good goal is to lose at least 5 to 10% of your current body weight. When you move more every day, you will burn more calories. This will help you reach your weight loss goal. Try to get at least 20 minutes of moderate exercise in every day. If you have not been active, start off slowly, building up to your goal. Try brisk walking, dancing, swimming, biking, jogging, and other physical activities that will help you get your heart rate up. You do not have to get all your physical activity at one time. Try getting some physical activity throughout the day in 10-minute sessions.